How much does the massage skill or the palpatory skill that you learn with the massage inform your choice of acupuncture points or what you do? Do you use it as in kind of diagnostically to inform your Chinese medicine practice?
Yeah, definitely. I'll assess them from a Western medical kind of musculoskeletal point of view, but then at the same time, I'm taking their pulse, I'm looking at their tongue, I'm doing the palpatory skills, I'm looking at the channels that are affected with where their pain is. I don't know, for example, a tennis elbow, you've got, pain all the way down the colon channel. And so you not only, this is what I've been doing recently, of treating somebody with tennis elbow, and you're releasing the extensors that, literally do this with your wrist and go all the way up to your elbow. You're releasing all of those all the way down, and then you're needling in the colon channel. And combined with that, you can needle a trigger point, which will deactivate will deactivate the trigger point and release a lot of tension. So it's just a really lovely combination to be able to put them all together.